Welcome to UCSI University 19th Annual Public Health Campaign 2021. This cancer information video, which is entitled Overview of Cancer, will discuss what is cancer, cancer statistics in Malaysia, some common causes of cancer as well as general signs and symptoms of cancer. Do you know what cancer is? Cancer happens when cells grow out of control and crowd out normal cells. Genes are the one that control cell growth and cell division. However, certain factors cause healthy genes to mutate. Over time, the mutations cause the cells to start growing out of control. The cancer cells keep on growing and they can spread to other parts of the body. Cancer is among the leading causes of death in Malaysian hospitals. Here are the top 5 cancer incidences among males and females. For males, lung cancer has the highest incidence, followed by colorectal cancer, prostate cancer, nasopharynx cancer and liver cancer. For females, breast cancer has the highest incidence, followed by colorectal cancer, ovary cancer, cervix uteri cancer and corpus uteri cancer. So, what causes cancer to happen? Smoking and tobacco, alcohol consumption, diet, obesity, hereditary factors and genetic mutations are the common causes of cancer. The first common cause of cancer is smoking and tobacco. Tobacco smoke contains cancer-causing agents which increase the risk of cancers. Do you know that second-hand smoke contains the same harmful chemicals as first-hand smoke? So, second-hand smoke can cause lung cancer even in people who have never smoked. Remember, do not smoke, as smoking will increase the risk of lung cancer in smokers. Some examples of cancer-causing agents in tobacco smoke are N-nitrosona nicotine, benzene, formaldehyde and hydrogen cyanide. Next, alcohol consumption is one of the most important preventable risk factors for cancer. Alcohol intake increases the risk of several cancers such as mouth, throat, voice box, esophagus, liver, breast, colon and rectum cancers. Do you know how alcohol increases cancer risk? Alcohol can cause damage to body tissues where it is converted into harmful chemicals in the liver. This can lead to damage inside the cells that might increase the risk of cancer. Next, alcohol can give rise to hormone changes and increases the level of estrogen, which is linked to breast cancer. Besides, alcohol also affects the body's ability to absorb essential nutrients, leading to a reduced absorption of nutrients. Moreover, a poor diet is one of the key factors that can increase a person's cancer risk, as what we eat and drink affects our health. For instance, processed meat and red meat results in an increased risk of cancer. Furthermore, being overweight or obese increases the risk of several cancers, including breast, bowel or colorectal, pancreatic, esophageal and gallbladder cancers. Besides, hereditary factors can lead to cancer as well. About 5% to 10% of cancers are due to inherited, mutated genes. For example, inherited mutation in the BRCA1 or BRCA2 genes is associated with breast and ovarian cancer. Colorectal cancer can be due to mutation in inherited MSH2, MSH6, MLH1, PMS1 and PMS2 genes, whereas inherited APC gene mutation is associated with colon and gastric cancer. In addition, cells become cancer cells largely because of mutations in their genes. Gene mutations occur with every cell cycle division. Normal cells repair mutations or cause cell death to protect against cancer. Gene mutations accumulate over our lifetime and increase the risk of cancer. Examples of environmental factors which increase the risk of cancer include water pollution, air pollution and ultraviolet rays. Next, let us look at the general signs and symptoms of cancer. It is important for us to know the general signs and symptoms. Different types of cancers exhibit different signs and symptoms, and these warning symptoms should be referred to the doctors as early as possible. There are 7 warning signs of cancer. First, change in bowel habits or bladder function. Symptoms such as constipation, diarrhea or a blood in stool may be a sign of colorectal cancer. If you are experiencing pain when passing urine, blood in the urine, or having the need to pass urine more frequently than normal, these may be the warning signs of bladder or prostate cancer. Then, a sore that does not heal. Sores that bleed or do not heal may be the signs of skin cancer. Meanwhile, if you have red or white patches on your gums, tongue and long-lasting sores in your mouth, it may be the signs of oral cancer. Unusual bleeding or discharge is one of the warning signs of cancer too. For example, coughing out blood may be a sign of lung cancer. Blood in stool for colorectal cancer, abnormal vaginal bleeding for cervical cancer, blood in urine for bladder or kidney cancer, and bloody discharge from nipple shows breast cancer. Besides, thickening or lump in breast or elsewhere. You may feel a lump or the thickening of skin, which may be the sign of cancer. The following sign is indigestion or difficulty in swallowing. Indigestion or heartburn are the common signs for esophageal or stomach cancers. In addition, obvious changes in a mole or a new mole where a spot on skin that changes color, size, or shape are the common sign of skin cancer. Last but not least, nagging cough or hoarseness. A cough that does not go away shows a common sign of lung cancer. Meanwhile, hoarseness or voice change may be signs of laryngeal or thyroid cancer. If you detect the above warning signs of cancer, please refer to the doctor as early as possible to have early treatment. Cancer prevention and early detection. Act early, save lives. Thank you for watching.